Moving on, in the Office of Substance Abuse, treatment and recovery plans are completed in partnership with the client as a result of the findings on clinical assessment. When the client sets employment as a goal, the agency must offer support, and the overarching premise is that recovery is possible. We know that employment and education are strong predictors of success. In elder services, employment is supported in the Senior Community Services Employment Program. Once a program in the Department of Labor, DHHS has assumed that oversight, with Goodwill Industries being awarded the contract. Low-income seniors have the option of being in this federally funded program for up to 4 years and must initially be re-entering the workforce. That seems to be more critical as those of us in this room who get more and more gray hair to our own futures. Nonprofit organizations agree to be host sites, and Goodwill matches up the senior with the job. And I tell you, more host sites are desperately needed. So as you're going about your work, if you make a contact to an employment site that's interested in a person who is skilled but elderly, please make sure you make the contact with Goodwill Industries. We don't easily see the barriers that seniors face in re-entering the workforce, but they are definitely there. Transportation, health, and sometimes cognitive ability are all factors. About 135 people go through this program each year, and the data reporting requirements are really heavy. When it comes to other areas of DHHS, I'm certain that most of you heard the claims that Maine creates welfare dependency during this last state election. The reality is that employment is the central theme around which the Aspire program within the Office of Integrated Access and Support operates. It's the offshoot to the TANF benefit. And participants in that program develop individualized plan that outlines steps they will take in reaching self-support. It's often interesting to me with the lens upon which I can look at DHHS, or through which, see that there are many people receiving Aspire benefits trying to go to work, and they are thought of as individuals without disabilities. But when one looks, it's all the same kind of agenda. Many of those, often moms, have either children with disabilities or disabilities themselves. The same strategies apply, whether you're talking to about an elder person who may have some cognitive challenges, a person with a disability who has that label, or a mom who's trying to get back on her feet to support her own family. For families who experience multiple barriers, resources from within the department and from partnering agencies are used to continue individual progress. It may be a surprise to most of you that approximately 30% of the adults in the Aspire program have paying jobs, and 50% of the working age adults in the Medicaid program are also employed. They continue this work in progress towards meeting the goals with the various support services. This may include help with car repairs, work clothing, eyeglasses, childcare expenses, especially critical, and transportation. Once families reach the goal of earning enough money to end their TANF benefits, the department continues to offer some transitional assistance to ensure families continue on their road to self-support. Some call this a tiered benefit. These benefits may include transportation, childcare expenses, and sometimes help with food. So you may be wondering, where's DHHS headed in this new administration, and what do we face as the challenges of dwindling resources are before us? It's a really good question. We know there's a significant budget deficit, significant's probably not a strong enough word, that will need to be addressed, and one that we can only speculate about what it will mean to your work. Governor-elect LePage ran on a platform of smaller government. There's been a dialogue about reducing DHHS expenditures, especially in Medicaid, to the New England averages, hard to figure out what those are, and trimming state programs. There's been a national dialogue about Republicans pushing to repeal health reform. On the other hand, there's also a dialogue about tiered benefits, work incentives, about making Maine a more desirable business climate, and about job creation. It's not all doom and gloom. Remember Governor McKernan? Under his Republican administration, the financing of long-term supports for mental health clients was developed. I hope that our new policy will guide us as we work to see clients succeed in the workforce, and that our partnerships with businesses expand as business expands in Maine. You might say there's a lot of work to do to change the statistics I've shared with you today. And though I will be seeing your work through my own new employment lens, I know you'll stay focused and passionate, and that ultimately you'll all be successful. Thank you for your commitment to helping actualize our policy and for helping our clients become Maine income taxpayers. Thank you.